2369 and open the public hearing on House Bill 2825. Madam Administrator, will you tell us what this is about, please?
Requires the House Bill 2825, Mr. Chair and Committee, requires the Oregon Health Authority to seek out and apply for grants and gifts and contributions to fund and appropriate monies pardon me, from the general fund to pay for crisis intervention services, residential care for individuals with mental illness. It also directs OHA to convene an 11-member work group and specifies the membership composition, has an emergency clause effective on passage. We have a -2 amendment that I believe will be addressed with our witnesses.
And it has a subsequent referral to Ways and Means.
It does, Mr. Chair.
Would you call the panel, please?
Sure. Chris Bonoff and Kevin McChesney.
Chesney, yes.
Chesney. Pardon me. Chesney.
And there's one other witness
Yes.
signed up.
There's one after that.
Okay. Whoever's starting, please identify yourself.
Good afternoon, Chair Green Lake, members of the committee. My name is Chris Boneff. I am the Executive Director of the Oregon State Chapter of the National Alliance on Mental Illness. We're a grassroots membership governed organization composed primarily of individuals and families directly affected by mental illness. I'm pleased to be here to speak in favor of this legislation, House Bill 2825. In kind of just in short, what it does is create something that we term a housing development incentive fund. It would take a state investment and provide that as a 20% incentive to those treatment providers and developers who would construct housing dedicated to individuals living with mental illness, and in particular, individuals living with serious mental illness. The term housing in this context is the broadest sense of the word, in that across our state we have a significant shortage of everything from high acuity licensed treatment housing all the way to very independent, what we would call supported housing for individuals living with mental illness. And I should note it's also for addictions. We have a significant shortage as well for housing around individuals living with addictive disorders, and in particular a tremendous shortage for people living with co-occurring mental illness and addictive disorders. This concept came about in 2012 when NAMI Oregon, as the economy was improving, we saw the state in position to make new investments in the community mental health system after years of really holding flat on funding. We convened folks that we thought were knowledgeable and bright thinkers on our issues, and so we brought together representatives from hospital systems, from the soon-to-be-formed coordinated care organizations, from our networks, in partnership with the Oregon Residential Providers Association. And in those conversations as to what new investments should be made, where they should be directed, we all really settled again on housing as that broad sense of the term. Hospital and systems were enduring, patients who were in acute psychiatric units were enduring longer lengths of stay than was really medically appropriate, because we didn't really have the step-down treatment centers. People in step-down treatment centers weren't able to really get into more independent housing when appropriate. People in independent housing really weren't able to move up into the system into short-term housing within their community setting that would allow them to really maintain their independence over the long term. And so it became clear that a common area agreement was housing. Then the question was, well, how do you pay for this, and how do you get the best return for state investments? Oftentimes in the past, the state would pay full freight for the type of environments we're talking about. but we went to the people who do the business and build these things and bring these projects together, and they essentially told us, if you give us 20%, we will find 80% of the financing elsewhere, which to us gave a pretty good return on the state investment. For every dollar in state funding, mental health funding, $4 would come from other sources. We proposed this legislation in partnership with the Residential Providers Association in 2013. Everybody thought it was a great idea. There was no money. Then there was a special session and an increase in the cigarette tax, and with that additional revenue dedicated to mental health services through an agreement process with Addictions and Mental Health Division, with NAMI, with residential providers, and with legislative oversight. $5 million was appropriated to this concept, and I'm pleased to sit here and tell you it worked. In a very short period of time, $5 million went out the door in the process that is, in a modified process that is more robust in this legislation. And that $5 million investment turned into $24.5 million in housing value across Oregon. In addition to some independent housing, affordable housing in the Portland area, there are 2 new respite programs that will be coming online in the Portland area, which are desperately needed alternatives to acute hospitalization and step down from acute hospitalization. But I think more importantly, there's also new independent housing going in Coos County, Curry County, Jackson, Lane, and Marion counties. So it is clear that what we had intended was a pool of flexible funding that would be able to fund needed projects in various regions, particularly as the regions went through planning. The CCOs went through planning what were the needs of people living with mental illness, that those funds would be available to develop the type of services or housing that met the regional priorities through that process. I guess it's not, as an advocate, right, I'm used to complaining about things, and I'm here to come up and tell you.
We've noticed that.
And it, and I say that with a grain of salt, because mental health care, I mean, you remind, we're coming out of a dark ages where you just would be grateful if you were equal with the rest of the healthcare system and complaining about what they're complaining about. But it's nice to come up and say, back in 2013, when we testified on this and proposed this, it was an idea. We knew it was an idea with merit because we had a lot of support. We had people from affordable housing coming out and supporting us. We had treatment providers supporting us. We had hospitals supporting us. So we knew it was an idea with merit. And now it's an idea that's a proven concept. And we're able to come before you and say it worked. And we would like to formalize that and make that a feature of our mental health care system. Thank you for this opportunity.
Thank you. Yes, sir.
Chair Greenlick and members of the committee, my name's Kevin McChesney, and I'm here today representing the Oregon Residential Providers Association. And I wanted to mention a couple of things. I mean, I think the need for housing of any type throughout the state is still overwhelming. And, I think the $5 million, I don't know exactly how many units it provided, but I really think that's just scratching the surface of the overall need. One of the things that's really changing the landscape a little bit is the settlement with U.S. DOJ in Oregon, and the limit that they're really saying, if you're going to provide housing for people with disabilities, that you can only designate up to 20% of the specific units in a development for people with disabilities. So what that really has created is the opportunity to do both housing for people with disabilities as well as affordable housing. And I wanted to also give you an example of one project that I was familiar with in terms of how we're leveraging these dollars and getting other investments involved in providing this housing. So I actually approached a broker that I knew who approached a developer and let them know of this opportunity that these funds were going to be awarded. As a result of that, they applied for funds from the City of Portland, urban renewal funding, and actually were granted those funds contingent upon receiving an award of the funds from the $5 million. Ultimately, the project came together. They received a $1.6 million award from that $5 million fund, and as a result, they will be developing a 40-unit apartment complex that will be managed and operated by Central City Concern. So a lot of partners came together to make that happen. I think they're also, I think we made a dent somewhat in the need to provide housing for homeless people. There's a significant need for housing first projects that would give people an opportunity to move into housing and then connect for services. And we're very appreciative of the continued investment in community mental health services.
Would this be for, are we talking about people who are homeless but also suffering from a mental disorder?
Mental disorders, substance use disorders, yeah, specifically.
And homeless as well.
And homeless, yeah. So there's, chronic homeless individuals who are difficult to engage in services, and unless we have housing to move them into that's readily available, they're not going to engage in services. So this type of funding provides opportunities for those individuals as well. So now that we are expanding community mental health services, we really need to have places for people to live so that they can have ready access to the services that they need and really have a safe place to live, and that's what they can build the rest of their recovery on. Thank you.
Other questions of these gentlemen? Representative Kenny-Geyer?
Thank you. I'm honored to be a chief sponsor on this, and I know you've put a lot of work into it. I remember hearing about it a couple of years ago, and it's great to see the direction it's gone. And it's one of 4 mental health bills that I'm bringing forward this time around. And one of the things I keep hearing is that when someone is coming out of acute crisis care, there's just so little in place to step down to. So the whole issue of discharge planning, where do people go, these are all different pieces of it. And I'm really excited about this bill. So thank you for taking the lead and championing this.
I think we're going to also get a briefing, and maybe we may want to find a way to do it with our joint committees, a further briefing on the DOJ settlement so we could introduce our committee to it. I don't know whether your other members, we have a lot of overlap between the two.
Yeah.
Maybe you could join in that.
Yeah.
Any other questions? Well, thank you very much.
Thank you.